of
Thank you.
time because we are running late for the lunch. We'll close the session and sorry for the delay in the lunch. We'll take a short break. It's around 2:15. We'll meet again at 2:35 sharp, please. Only 20 minutes break. Please have your lunch. And we have a small change in our scientific schedule. We have a very important talk, literature review, metabolic ressuscitation by none other than the current national president of ISCCM, Professor Dr. Pradip Bhattacharya. So that's one important talk we have. And we do also have a website launch of ISCCM Hyderabad. So we are awaiting you again. Please, we will break for lunch. Thank you very much. Sorry.
Lakshmi Rani ma'am, please, sir, Chandrasekhar sir, please felicitate her, sir. Oh, please. Would like to call Dr. Ramesh. Abdul Qadir, Dr. Abdul, please. Dr. Mishra, please felicitate her. Ramesh nahi hai. Dr. Ramesh nahi hai. Thank you all the speakers and chairperson, sir. Thank you for your time.
For having a quick lunch. Thank you all. So coming to the next session, it will be a literature review on metabolic resuscitation. It will be run by none other than Dr. Professor Pradip Kumar Bhattacharya, sir. He is the President National ISCCM, and he is the and is also a professor, head of department critical care medicine at Rajat Institute of Medical Sciences, Ranchi. Professor Bhattacharya.
Thank you very much. And thanks to Critic 2024 or all organizing chairmen, secretaries, and all other organizers who have invited me and given this opportunity to deliver something in front of you. So my job is to go through this literature review of this topic, that is metabolic resuscitation. It is an important topic, obviously, but I don't know about the future of this metabolic resuscitation, because there are lots of confusions. Whatever we have gained till now through various researches are not satisfactory or up to the mark that we can straight away say that yes, we can implement these practices in our clinical scenario for managing patients with sepsis and septic shock. Anyway, but we'll see what are the things which has happened in last almost 8 to 10 years. So first of all, what is metabolic resuscitation? The intervention to improve mitochondrial activity. That means inside the cell, and that is afforded by pharmaceutical and nutritional agent to reduce multi-organ dysfunction syndrome severity as well as mortality. Yeah, and that is what has been defined as metabolic resuscitation. And the components which has been selected to say this metabolic resuscitation, which will help actually, are basically thiamine. That is of particular interest because its deficiency is common in hypermetabolic state like sepsis, and other supplementations like ascorbic acid, selenium, zinc, then L-carnitine, melatonin, all those things are there, but we lack with the number of studies against these molecules. But obviously, we have something to say as far as thiamine, ascorbic acid, and hydrocortisone. So these are the three things which are being studied very aggressively in last 7 to 8 years. So first is thiamine. Now you all know, I think you must have read in theory that yes, how thiamine works, because thiamine is one of the important component which helps in the conversion of pyruvate to acetyl coenzyme A by combining with pyruvate dehydrogenase, and that is how it is important for the oxidative cycle. And so the maintenance of Krebs cycle requires the presence of thiamine in the blood. Otherwise, what happens in its absence, the pyruvate gets converted to lactate, and that is a harmful substance we all know in critical illness. Another important thing which thiamine does is that it stimulates transketolase, and by that it activates this pentose phosphate pathway, and it helps in conversion of NADP to NADPH, and that's how that reduces the reactive oxygen species through glutathione cycling. So this is another important way how this thiamine works. Now, another vitamin C, ascorbic acid, how it works. So this is a broader part of this entire cycle through which ascorbic acid actually maintains the different mechanisms inside the body. But basically, it prevents the generation of new free radicals through its suppressive effects on NADPH oxidase pathway. And that's how it reduces the endothelial permeability, which usually happens in shock. It improves the microvascular and macrovascular function, and it attenuates the cellular apoptosis in pathological states. So there are multiple functions, and it also helps in reduction of the consumption of endogenous vasopressor, and also important in maintaining a vascular vasopressor responsiveness. That is one thing which is lost again when a patient goes into sepsis. It has also got effect in microvascular dysfunction like cellular apoptosis, endothelial dysfunction, and vasodilatation. So multiple. So once you come to this, uh, the final mechanisms, so you can see that it helps in epinephrine synthesis. It has got a bacteriostatic effect. It helps in preventing this neutrophil oxidative burst. It improves the microvascular dysfunction. It prevents cellular apoptosis, endothelial dysfunction, and prevents excessive vasodilatation, which can happen during sepsis. So all these are additional functions when we see up. Then the third thing which has been combined is hydrocortisone. That is one of the important component, and all the studies which has happened either in single study with including vitamin ascorbic acid or thiamine or a combination of these three molecules together. So how these glucocorticoids work in the presence of ascorbic acid? Glucocorticoids binding to the glucocorticoid receptors is generally affected by oxidizing molecules. And this is where this vitamin C helps by restoring glucocorticoid receptor function. And the cellular uptake of ascorbic acid, that is mediated by sodium vitamin C transporter, and that is called SVC2TZ T2, and that which gets down regulated during the sepsis. And once ascorbic acid is given, this gets reactivated. Now, because today's discussion is on literature review, now let us see what are the literatures which are there in support or against the use of thiamine in critical care. So thiamine as a metabolic resuscitator in septic shock. This is one of the latest meta-analysis of all the randomized controlled trials which has happened since 2016 onwards. And here the author has conducted this meta-analysis in septic shock patients, and they have assessed the utility of thiamine without ascorbic acid as an adjunctive therapy. So first of all, only thiamine without use of ascorbic acid. So there were 5 studies which started from 2016 in 2022. There are 5 studies, and although the slide may look crowded, but these are the 5 studies, and these were done in septic shock patients. And amongst them, the last study that was done by Nandini et al. And it was published in International Journal of some Infectious Science, and that has shown that obviously thiamine has some positive effect in patients with sepsis and septic shock. Rest all, they do not suggest any positive effect of thiamine in patients with sepsis and septic shock. And they found that yes, obviously delta SOFA in these patients have been reduced, and also they have found there is a reduction in the level of lactate, and that is why reduced mortality also. And this is the study that is done by Nandini, and it was published in 2022. Comparison of the effect of vitamin C and thiamine on refractory hypotension in patients with sepsis. And the conclusion was that in patients with septic shock treated with hydrocortisone and co-treatment with thiamine led to earlier correction of organ dysfunction, reduced need of renal replacement therapy, and improved mortality compared to patients treated with ascorbic acid or balanced salt solution. So the addition of ascorbic acid did not yield measurable benefit beyond hydrocortisone alone. So this was one positive study, and these are the forest plot. You can see that the last study only shows uh, some benefit. This was Nandini's study. Here you can see it favors the use of thiamine in patients with septic shock. And what about the delta SOFA improvement? Here again, you see this Nandini study only suggests that there is an improvement in delta SOFA, and also need of RRT has been reduced. Here this Nandini study only this is the only study which suggests that there is some benefit. So you can say that yes, obviously uh, we can use this thiamine, but study is not so robust, or this does not carry so much of impact or power that it can be recommended for regular practice. Now, if you look at this chart, this is the whole cycle of physiological cycle of ascorbic acid, hydrocortisone, and thiamine, because people found that not alone, but when combination of thiamine, ascorbic acid, and vitamin C are used, the patient's outcomes are better as compared to when you use these components in an isolated manner. So that is why further studies which were taken from 2016, they either took ascorbic acid as a sole therapy, or they combined these 3 components to see the outcome of various patients. So almost 18 studies are there since 2016. Almost 18 randomized controlled. I'm not talking about all the studies. I'm talking only about randomized controlled trials. So there were 18 studies which were done from 2016 till 2022, and I'm presenting all studies one by one, And after that, I'll present one meta-analysis, what it says, and the final conclusive remark. So in 2016, this was the study of effect of high dose ascorbic acid on vasopressors requirement in septic shock. Here, the authors conclude that high dose of ascorbic acid may be considered as an effective and safe adjuvant therapy in surgical critical ill patients with septic shock. And the most effective dose of ascorbic acid and the best time for its administration should be determined in future studies. Then it was the only study 2016. After that, this is 2019, the citrus-ali trial, which was long awaited because at that time we started using this and we said, okay, we are waiting for this citrus-ali trial. Citrus-ali trial, although it was done by a lot of enthusiasm, after Marik's recommendation that these are the things which should be used in patients with sepsis and septic shock, it suggested that in this preliminary study of patient with sepsis and ARDS, in 96 hours infusion of vitamin C compared to placebo did not significantly improve organ function. So organ dysfunction score or alter markers of inflammation or vascular injury. So it was a negative outcome of this long awaited and big randomized trial, which was published in 2019 in JAMA. Now, after that, in 2020, almost 5 to 7 trials were published, 7 randomized controlled trials. So this first one is Oranges trial, that is the outcome of metabolic resuscitation using ascorbic acid, thiamine, and glucocorticoid in the early treatment of sepsis. And what was the conclusion? That they said that a combination of IV ascorbic acid, thiamine, and hydrocortisone significantly reduced the time of resolution of shock. Another study, which was published in Intensive Care Medicine, they said that vitamin C and thiamine administration in the early phase of septic shock did not improve organ function compared with placebo. So all contrary results, which you see. Then another 2 studies, which again came, 2 randomized trial 2020 only. So this was again in combined treatment with hydrocortisone, vitamin A, and thiamine for sepsis and septic shock. Here they say that among patients with sepsis and septic shock, the combination of hydrocortisone, vitamin C, and thiamine did not reduce mortality. Negative. What about this vitamins trial, which also came in published in JAMA in 2020? In patients with septic shock, treatment with intravenous vitamin C, hydrocortisone, and thiamine compared with intravenous hydrocortisone alone did not significantly improve the duration of time alive and free vasopressor admission over 7 days. Again, a negative trial. Now, after that, again, 2 more trials. One was in infectious disease, London, and another was in Indian Journal of Critical Care Medicine. What they say, the first trial says that addition of vitamin C, hydrocortisone, and thiamine into standard care of sepsis does not improve in hospital or 30-day mortality. However, low vasopressor use and faster lactate clearance is observed with the treatment. What about this, which is published in Indian Journal? They say intravenous administration of vitamin C, thiamine, hydrocortisone did not significantly improve the patient all-cause mortality among patients with septic shock. So, if you look at all these trials, you'll obviously get confused, but that is why meta-analysis. I'll come to that. Now, this is another trial, 2020, which was published in JAMA, and this name was ACTS trial, the ACTS randomized controlled trial. Here again, they said that in patients with septic shock, the combination of ascorbic acid, corticosteroid, and thiamine compared with placebo did not result in a statistically significant reduction in SOFA score during the first 72 hours after enrollment. So again, negative. Now come to 2021. Again, there were 3-4 randomized trials which were published in 2021. So first was this Victas randomized trial, and what it said, among critically ill patients with sepsis, treatment with vitamin C, thiamine, and hydrocortisone compared with placebo did not significantly increase ventilator and vasopressor free days within 30 days. So negative, more and more negative. Let us see what other trial says. Again, this was another trial which was published in Journal of Residence Medical Science. And here they said that the administration of triple combination of hydrocortisone, vitamin C appeared to be effective in improving the clinical outcome patients with septic shock. Another study, this is Internal Journal of Clinical Practice. They say vitamin C, thiamine, and hydrocortisone regimen for septic shock management showed non-significant efficacy in decreasing 28-day mortality compared to hydrocortisone monotherapy. So a different way of doing the study, but some positive result. Now, again, another trial, 2021. Iranian Journal of Medical Science. What they say, the early treatment of sepsis with intravenous high dose vitamin C in combination with therapy showed a beneficial effect on sepsis in terms of reduced 28-day mortality. In 2022, almost 4 or 5 trials were published, randomized trials. So as I said, total 18 trials. Now, this was published in New England Journal of Medicine, and they concluded that in adults with sepsis receiving vasopressor therapy in ICU, those who received intravenous vitamin C had a higher risk of death or persistent organ dysfunction at 28 days than those patients who received placebo. This was on the opposite side, more of adverse event. Okay. Then another trial which was published in Critical Care Journal 2022 randomized trial, intravenous vitamin C administration in patients with septic shock, a pilot randomized trial. They say that intravenous vitamin C did not improve significant decrease in mean dose of duration of vasopressor infusion, and they said further research is needed. What about this trial published in Critical Care Medicine 2022? They say that vitamin C monotherapy failed to significantly reduce mortality in septic shock patient as hypothesized. Our findings do not support its routine clinical use for this purpose. Okay. These were 2 more trials. One was published in Anesthesiology, and this was a double-blind randomized controlled trial. It said that early use of high dose of vitamin C intravenous infusion in patients with sepsis during mechanical ventilation in combination with the standard treatment of sepsis lowered the incidence of VAP and increased the antioxidant status and improved illness severity. And another one, which was published in Critical Care 2022, they said that amongst adult patients with septic shock, early use of hydrocortisone, vitamin C, and thiamine combination therapy compared to placebo did not confer survival benefits. So many ifs and buts. So I presented all 18 trials, 18 randomized trials which were done between 16 till 2022. After that, this meta-analysis came, and they included all those randomized controlled trial in one, and they tried to find out what exactly should we get out of this. So a total of 18 randomized controlled trials, including 8 multi-center RCT studies and 10 single center studies were involved with the initial vitamin C intervention plan, classification of the disease, initial SOFA score, duration of vasopressor, and mechanical ventilation. All those you saw in all those trials which we just now gone through. And this was the interpretation. You can see the forest plot which they have given. Now you see those which are on this side and those which are on this side. And this side, it suggests that it favors use of vitamin C. So what was their interpretation as far as delta SOFA? That means delta SOFA means organ function is improving in the passage of time with the use of this vitamin C and thiamine. So they say delta SOFA score suggests whether organ function has improved or not. And although they say that although several randomized controlled trials with delta SOFA score as the primary outcome found that IV vitamin C did not significantly improve function compared with placebo, this meta-analysis indicated promising results that IV vitamin C could significantly improve delta SOFA score after integrating multiple randomized control trial, all those which I've shown, which was validated by trial sequential analysis. Now see here, again the jugglery, that is the terminology, trial sequence. When we saw straightforward, most of the trial they say they are not beneficial. But this meta-analysis says this, yes, vitamin C is beneficial. Now, what is trial sequential analysis? This is another way, a frequentist method of finding out the probability or significance of any study which has been done. So, trial sequence analysis is a statistical method for adjusting for the effects of repeated significance testing in meta-analysis. It is a valuable tool for improving the reliability and accuracy of meta-analysis. And TSA, it helps in prevent spurious findings that can occur when the same data is analyzed multiple times. A new trial are added to a meta-analysis. Means when you add one trial, you will find that significance is different. Another trial significance is different. Another trial significance. So go on adding the trials and you will find that significance are different. But what this trial sequential analysis does, it neutralizes all those errors. So that is why in traditional meta-analysis, every time a new trial is added and data is reanalyzed, we are essentially performing another statistical test. Secondly, when there are a few studies, results can fluctuate dramatically due to a random variation. This can lead to premature conclusions. And that is why most of the trials they have said, no, vitamin C is not useful for their patients. So TSA actually reduces false positives, increases confidence in finding, and prevents unnecessary trials. And this is the beauty of doing TSA and applying it in meta-analysis. And this is a new way of going and looking into various meta-analysis. So in this meta-analysis, the author applied TSA version. It is a costly software and found to perform this TSA for both delta SOFA and short-term mortality outcome, because these are the two things on which we actually look for. So, as I said, it has shown that delta SOFA is improving with the use of IV vitamin C. And what about short-term mortality? If you look at the entire forest plot, look at this. When you give it its a proper place in this confidence interval graph, the outcome analysis revealed that IV vitamin C in sepsis or septic shock patient was not associated with improved short-term mortality. So as such, obviously they help in improving the function of the organs, but when mortality comes, as such, it has got no utility. So there was no statistical difference between IV vitamin C combination therapy and monotherapy. The outcome was contrary to the study which was done by Marek, as I said, Paul Marek, which suggested that combined treatment could decrease hospital mortality, which was done 2015, published, and that was a very hit study at that time. So, and they also said that about the dose, how much dose if we are using, they said that 25 to 100 milligram per kg per day. That is the maximum dose which you should use to get if you want to get some benefit. Now, what about duration of vasopressor use? Again, the same sequential analysis was applied and they found that despite the lack of mortality benefit, this meta-analysis suggested that vitamin C could significantly reduce the duration of vasopressor use. So that is what we saw when we saw the mechanism of action of vitamin C, that it preserves the function of endothelium and it sensitizes the vascular endothelium to hydrocortisone, and that is one of the way, that is how probably this is showing a good outcome. What about adverse event? They say adverse event of vitamin C were rare, but no studies. There were two studies which actually shown that one was done by Chang and Ryu studies. Two studies shown, one was this, another was this. They showed that there are some adverse effect when you use vitamin C in these patients. As such, otherwise, vitamin C has got not so much of adverse effect when it is used in a moderate dose. Now, we went through all the literatures. So the conclusion is metabolic resuscitation in sepsis, because these are the studies which has been done, or septic shock patient using thiamine, ascorbic acid and hydrocortisone significantly improved delta SOFA score and reduced the duration of vasopressor use. These are the positive things which we found, whereas it was not associated with a reduction in short-term mortality and had higher adverse events. So what you can do as a practitioner, most clinical studies have not reported any serious adverse effect with this HAT therapy. So this therapy has a good safety profile also, as I said, not much of adverse event. Therefore, therapy can be promising new treatment. New treatment means although we are using, but yes, obviously it has not established, recommendation has not come. So as a metabolic resuscitator, you can use it currently, but we do not know about the future. But presently, although there is no recommendation, but you can use it safely if you feel your patient is not responding to other therapies. Thank you very much. So all of you are welcome to this Criticare 2025 at Kochi. Thank you.
Sir, I request you to please be and stay, sir. Thank you, sir, for that in-depth analysis and excellent talk. We go to our next session is as a ICCM Hyderabad. It's our honor and privilege to felicitate Professor Pradip Bhattacharya, sir, on his esteemed position as National President of ISCCM. To felicitate him, we have none other than the current National President-elect, Dr. Srinivas Samvedam, sir. I request Samvedam, sir, to please come on the dais to felicitate the current National President of ISCCM. I also request all the EC to come on the dais, also the National EC, Dr. Pawan, Dr. Venkatraman Kola.
Thank you, sir. Thank you so much for coming. And actually, for all your support for the ISCCM Hyderabad, we have been honored to have you. We are actually utilizing this occasion to tell something about the ISCCM Hyderabad website. And we have been having a lot of academic events all through the seniors major activities throughout the last many of the years. What we thought was over a period of time, we'll have a single website where we'll have all the overall previous activities, past ECs activities, our achievements. Our students have been one of our major strength. They've bagged many of the prizes at the national conferences, international conferences. What we thought was we'll have a single place where all of them will be conglomerated and we can have a reference one, and that will be the page where the future activities also, future conferences, everything will be tackled from there. So this most of this work has been done by Dr. Prashant. uh, Prashant, I want you to do this one. So Prashant has been a major help for us, along with Dr. Adarsh and Dr. Srinath and Dr. Anveshi. They have been trying to have a newsletter. Maybe down the line we'll have it, but so this occasion we wanted you to inaugurate our website, sir. And before that, Samadam, sir, couple of words about the website, and Pradip, sir, will.
It's a pleasure and honor to be here with somebody whom I have learned a lot for the last 15, 20 years. Somebody who's given me the first opportunity as faculty at Criticare way back in 2008 in Bhopal. That's where I got my footing into the ISCCM activities, and learning from such seniors, I think, is always a good experience for me. And it's my honor and privilege that today I was called upon to felicitate Pradip sir.
Open curtain. Come.
Open.
ऊपर आ जाओ. ये ना?
Yes.
Good. Very nice. Thank you.
Good afternoon, everyone. It's been an honor to be a part of ISCCM Hyderabad chapter website designing, and I'll show you the gist of the ISCCM Hyderabad chapter website, where this is the main banner. As you know, ISCCM Hyderabad chapter is producing more than 500 people of critical care physicians every year, and you can see almost 2019, 20, 21, three I mean best city best city award has gone to ISCCM Hyderabad chapter. For the recognition of it, we have even got a lifetime achievement award, and we have almost like more than 5 people from ISM Hyderabad chapter in the national EC members as a president, vice president, general secretary, zonal member South, and EC member also. And we do have many students who have got prizes in the not only national, even in international regions also. Here we do have a welcome message and even upcoming updates where we can directly go on to the website, or like, and even we do have a dedicated YouTube channel which was launched in 2021 during COVID times, which helps which helps the critical care physicians in being on the same platform. And even we have a Facebook page also dedicated for ISSM Hyderabad chapter, and we have media, and we have newsletter where every 3 months or 4 months we will be releasing a bulletin where we have a dedicated place for doctors who are present in Hyderabad chapter. They will be they can mention their difficult cases, how they managed, and even their extracurricular activities also can be placed over here. A dedicated website, mail, and even phone number is also be provided. Please, I encourage everyone to make sure that it will continuously run. And we have a student corner here where we every weekly one question will be given and even answers will be also explained. Here we do have our history, which we have started in almost like more than 2 decades. Every decade, like every 10 years, we are um, uh, organizing cricket. And next, coming to executive committee meeting and even publications we do have. And you can go through lot more options are there, like even you can see, and from the here you can see even the contact where Swarnadeepak sir and even Naim as a point of contact. Here you can use a navigation place and even the useful links where you can go. Thank you.
Thank you, everyone. So before we close this, I think I'll just request all of you to actively contribute to the newsletter, make it interesting. It's a bulletin from Hyderabad. It will be complementary to our main newsletter, the main one which will coming, and also actively participate in the quizzes. And our students always been our biggest pillar of the strength. And I urge you to continue your previous seniors, all your present students. Thank you, sir. Then I'll invite Pankaj to continue the session.